is actually my little foster puppy. She found a new home last year, but she's there helping me study. So specific prevention for puppies and kittens. So typically we would advise doing a preventative dose at intake. Usually that's a one-time dose, and you do that typically with other GI parasites as well. You want to have separate housing areas, so you don't want to be housing your puppies with your general population. You want to have them in a separate area, same with your kittens. You want to limit interactions between different litters of puppies. So while you have all the puppies in a separate area, you don't want to necessarily put all the puppies that you have into one big room, because one litter could be infected, but another litter may not be. And so play groups and play areas, you do want to let the dogs outside. They do need to have social interaction, but you need to kind of weigh the risks of, was there another animal in that play area that was infected with Coccidia? If there wasn't, you probably don't want to put puppies that are negative in that area. So try and get the puppies and kittens out to foster homes as much as you can. It decreases the stress that they have in the shelter. It also protects them if there are other positive puppies in the shelter. Or kittens. You want easy to clean cages, so not wooden, usually metal works well, or cement floors, that type of thing, not carpet basically. Disposable litter boxes. So you may think that you're scooping out all the feces, but you might miss a tiny that's on the side of the litter box, and that can be a potential source of reinfection even if you're treating. So just getting rid of the whole litter box, especially for puppies and kittens, can be really effective for that. You want to handle the puppies and kittens with clean clothes and gloves if you can, especially if they're going between different sets of animals as well. And limit exposure, so you don't necessarily want all of your volunteers to be going between the puppies and then the kittens and then your general population. If you can, have a specific volunteer staff that's designated for the puppies for that day or the kittens, whatever your shelter can kind of work out with that. So removal of feces within hours. So remember, the eggs aren't infective until about 16 hours at the earliest, but we don't want to risk possible infection. So if we remove the feces within hours, then we should be clear of that. So unlike Giardia, there's not really a disinfectant or cleaner that's really great for getting rid of Coccidia. We typically rely on steam or boiling water to get rid of it, which isn't that effective. So you can kind of see where some of the challenges arise. Pressure washing can sometimes loosen the eggs off of surfaces, so that can be another aid. And make sure that the surfaces are dry after cleaning. Similar to Giardia, you don't want to be putting an animal in there if the cages are still wet. Painted floors and walls. So if they're painted, it's a really clean surface and the eggs tend to not stick on there as much as, say, carpet or some other material. So spot versus deep cleaning. The trend right now is kind of to recommend spot cleaning. It reduces stress of the animals. They don't have to be necessarily removed from their cage and have everything removed all at once. But you also need to think about risks of reinfection. So if you say you leave the litter box in there and don't necessarily scrub it out or have a disposable litter box, that could be a potential source of reinfection. But also, if you're doing a deep clean all the time at various times of the day, you might be causing extra stress to that animal, which is an increased risk factor.